This video contains information about the use of Gonal F RFF. This drug has been prescribed to you by your doctor for treating infertility. To help you prepare and use this medicine, watch this video and read the instructions provided carefully. Ask your doctor, nurse, or pharmacist to explain anything you do not understand. Keep the leaflet. You may want to read it again. Preparing and self-administering Gonal F RFF 75 IU. Getting ready. Be sure to have all of the following items before you begin: Gonal F RFF 75 IU powder vial, pink mixing needle 18 gauge 1.5 inch, red injection needle 29 gauge 1/2 inch, pre-filled syringe labeled sterile water for injection USP, alcohol swabs, sterile gauze pads, and a sharps container. Wash your hands with soap and water and make sure you are working on a clean, flat surface. Step 1. Mix. Using your thumb, flip the protective plastic cap off of the Gonal F RFF vial. Wipe the top of the bottle with an alcohol swab. Hold the barrel of the pre-filled syringe of sterile water in one hand. Firmly hold the plastic cap between the thumb and forefinger. Gently snap and pull off the white cap. If the gray cap inside remains, simply remove it. Remove the safety seal cover of the 18 gauge 1.5 inch pink needle. Twist the mixing needle on the pre-filled syringe until it is tightened. Holding the barrel of the pre-filled syringe, carefully remove the needle cap. With the vial of Gonal F RFF powder on a flat surface, insert the needle of the pre-filled syringe straight down through the marked center circle of the rubber stopper. Slowly inject the water into the vial by pushing down on the plunger. Leave the 18 gauge 1.5 inch needle and syringe in the vial. Gently rotate the vial between your fingers until the powder is dissolved. Do not shake the vial. If bubbles appear, wait a few moments for the bubbles to settle. The liquid drug should be clear. Step 2. Draw up. Without removing the 18 gauge 1.5 inch pink needle, invert the vial and slowly pull back the needle as far as needed and withdraw the entire contents of the vial into the syringe. Make sure the tip of the needle remains in the solution by slowly backing the needle out of the vial to withdraw as much of the solution as possible. Remove the 18 gauge 1.5 inch needle and syringe containing the solution from the vial. If your dose requires more than one vial of Gonal F RFF 75 IU, use the mixture in the syringe to reconstitute the next vial of Gonal F RFF 75 IU powder. Use the same 18 gauge 1.5 inch needle and syringe to reconstitute additional vials. Repeat this process until you have the prescribed number of vials dissolved for your recommended dose. You may have unused mixing needles and pre-filled syringes of sterile water for injection left over. Gently move the plunger back to allow for a small air space. Carefully recap the needle. Twist off the mixing needle from the syringe and discard in your sharps container. Remove the safety seal cover from the 29 gauge 1/2 inch red needle. Twist the needle onto the pre-filled syringe until it is tightened, being careful to keep the protective cap in place. Holding the barrel of the pre-filled syringe, carefully remove the needle cap. With the syringe pointing upward, gently tap on the syringe. Slowly push the plunger until all of the air bubbles are gone. A drop or two of liquid will appear at the end of the needle. Carefully recap the needle and lay the syringe on a clean, flat surface. The syringe is now filled with the prescribed dose of Gonal F RFF and is ready for administration. Step 3. Inject. Your doctor, nurse, or pharmacist should provide you with injection training. Inject the prescribed dose as directed. Usual injection sites include the skin on the stomach, upper arm, or upper leg. Change the injection location each day to minimize discomfort. Your healthcare provider will have discussed a suitable injection site with you. Clean the recommended injection site with an alcohol swab and allow it to air dry. Uncap the injection syringe. Hold the syringe in one hand the way you would hold a pencil. With the other hand, pinch the skin around the injection site. Insert the entire length of the needle completely straight into the skin at a 90-degree angle. Once the needle is inserted, you may release the pinched skin and push the plunger in a slow, steady motion until all the medicine is injected. Gently withdraw the needle and apply pressure to the injection site with a sterile gauze pad. Step 4. Disposal. Discard the empty syringe in your sharps container. Do not throw away empty syringes or loose needles in your household trash. If you do not have an FDA-cleared sharps disposal container, you may use a household container that is made of heavy-duty plastic, fitted with a tight, puncture-resistant lid, leak-resistant, upright and stable during use, and properly labeled to warn of hazardous waste inside the container. When your sharps disposal container is almost full, follow community guidelines for how to dispose of it. For more information, go to www.fda.gov/safesharpsdisposal. Step 5. Storage. The Gonal F RFF 75 IU may be refrigerated or stored at room temperature between 36 and 77 degrees Fahrenheit. It is important to keep Gonal F RFF 75 IU out of the sun. For more information and full prescribing information, please visit www.fertilitylifelines.com or call 1-800-LET'S-TRY. Important information about the proper use and risks of Gonal F RFF, folotropin alpha for injection. What are the uses of Gonal F RFF? Gonal F RFF contains folotropin alpha, which is similar to the human hormone follicle-stimulating hormone, referred to as FSH. FSH belongs to a group of human reproductive hormones. It is used in certain infertile women to help in the production and release of a mature egg and pregnancy. Gonal F RFF will not help women whose ovaries no longer work because of a condition called primary ovarian failure. Gonal F RFF may also be used in women who are in an assisted reproductive technology program, such as in vitro fertilization, to help their ovaries make more eggs. Who should not use Gonal F RFF? You should not use Gonal F RFF if you are or think you might be pregnant, have primary ovarian failure, ovaries no longer producing eggs, or have an allergy to recombinant human FSH products or any other ingredients in the medication. Do not use Gonal F RFF if you have cancer of the sex organs or brain, or uncontrolled thyroid or adrenal disease. Women with a history of abnormal bleeding from the uterus or vagina, or with swollen, enlarged, or painful ovaries should speak to their doctor before starting treatment. What are the possible side effects of Gonal F RFF? The lowest dose expected to achieve the desired results should be used. Your doctor will monitor your response to avoid overdose, which can lead to serious side effects, including blood clots. You should contact your doctor if severe pain or bloating in the stomach or pelvic area, severe upset stomach, vomiting, or weight gain are experienced during treatment. These could be signs of a rare but serious condition known as ovarian hyperstimulation syndrome, or OHSS, which can result in hospitalization. Use of Gonal F RFF by a woman can be associated with fertilization of more than one egg. This can lead to complications for the woman and the birth of 2 or more babies. The most common side effects reported by women were headache, ovarian cysts, upset stomach, and sinus infection. Injections may cause some discomfort.